Lawyer for American Home Products.
Okay, by all means.
Good evening. Today I am going to talk about the information and the data that the Food and Drug Administration used in order to make up to my client, American Home Products, to voluntarily remove Fen-phen from the market. The actions taken by the Food and Drug Administration prompt that a significant number of former Fen-phen users sue my client in civil court. The FBI, the Federal Bureau of Investigation, conducted its own criminal investigation, and as of today, my client hasn't been charged with any charges have not been filed on behalf of my client. So while we are here, my client's product Fen-phen was a very popular drug for weight loss. And in 1997, 24 cases of valvular heart disease, and from now on I'm going to call valvulopathy, 24 cases of valvulopathy were found in women that used Fen-phen. In these cases was reported to the FDA. Also cases of primary pulmonary hypertension, now called PPA, please stay, please, were also reported. The pathology of VHD, of heart valvulopathy, reported that these findings in the echocardiograms of Fen-phen former users were similar, the pathology were similar to carcinoid-induced valvular disease. This disease, carcinoid-induced valvular disease, is induced by serotonin. Our product, we're going to talk about mostly the Fen, actually promotes the rapid release of serotonin and inhibits its reuptake. Basically, what happens is that during a synapse between cells, the excess serotonin that doesn't go into the cell is actually going to the bloodstream, affecting the heart valves and the parts of the lungs, and it will cause, therefore causing cancer tumors. What is Fen-phen? Fen-phen is a combination drug between fenfluramine and phentermine. Fenfluramine is an amphetamine. This amphetamine, fenfluramine, what basically is works in the metabolism of the cells, and basically what happens is that serotonin levels are level by Fen. Therefore, this causes in the patient who is taking it to have a sensation of being full. Therefore, they will not eat more food. Fen was approved by the FDA in 1972 as an appetite suppressant, and was marketed by the name of Fen-phen by my client, American Home Products. The second part of the combination drug, phentermine, was added to minimize the Fen's side effects. Fen is still on the market and it's not part of the trial. By the numbers, 18 million prescriptions by doctors were done Our doctors prescribe 18 million drugs of Fen-phen. An estimated 3 million persons in the US use the drug, sold by FDA pharmacies, approved pharmacies. An estimated 60 million of the drug were sold worldwide. And the total number of cases on unusual valvular morphology reported in the FDA case were 24. 18 million, 60 million, 24. This chart summarizes the data collected by the FDA that was later put in his report, in the report. They collected data of approximately a population of 284 patients that were using Fen-phen. This is the percentage of females that were used, so mostly the patients that participated in the study were females. It's a median of 87. The median age is 48. And these are the drugs, the doses of the drugs that were the patients were taken, and the median exposure of the drug 14 months. This data was given to the FDA by offices of drug weight loss centers, and then were sent to 3 cardiologists who didn't know that these patients were on Fen-phen medication. So what they found, these 3 cardiologists, from a population of 284 persons, 32% gave positive to valvulopathy out of 282 persons.
You said 32%?
32% out of 282. This percentage.
Mm-hmm.
This is the states where the samples were taken. This is the entire population of the study.
What is the 30%?
Huh?
The 30%?
30% is the positive person that gave to valvulopathy.
So 30% of the people who were taking the drug had side effects. 30%.
Yes.
Only valvulopathy, so we're not even talking about the other side. But this is not.
No, we're not talking about the grade or if it is normal for obese people to have valvulopathy too.
Mm-hmm. So this is completely unrelated to the other study.
Well, the thing
The other
is,
study was 24 for like.
yeah, but the FDA used this study to take my client's Fen-phen product out of the market. That's why we
There
are
was
so, that we're so making so much emphasis in this study.
Okay.
So that's why this is being offered as evidence. This is being offered as the evidence for why the FDA asked for the recall.
Because actually, the person who is suing our client, he's suing. Yes, she felt some symptoms, but she's using the FDA credibility as their standing for their case. "32% of valvular lesions were for patients using Fen-phen. As you can search and look in the papers that I saw you about the official FDA study, they use preliminary reports from large population studies of adults who are diagnosed with valvulopathy. So these preliminary studies that the FDA used to compare for their study gave less than 5%. So what the FDA said, our study says 32% of people have valvulopathy. But the general population is supposed to have at least less than 5. That's what the red alarm came from the FDA. But the thing is, we don't know what's the definition of large population from the FDA. They don't say what is large population. Could be 500, 200, 1,000. They don't say. The FDA report doesn't address the mechanism of how Fen produces heart valve injury, nor who's at risk of developing heart valve disease, nor the public impact of this medicine. These are the references of the FDA study. Our first reference is Ms. Heidi Connolly, which is the paper that I gave you from the New England Journal of Medicine. She's stating that this drug was not approved by the FDA. 8 million prescriptions. 18 million prescriptions were done by.
She's saying what?
She's saying that the Fen-phen drug was not approved by the FDA. The main scientist of this FDA report. But Yun, can you do me a favor? Can you tell me what is the name of the scientist that the FDA refers in number 5? It's either here or in the last page of the FDA report.
Oh, you say
Yeah, you can know it's the other paper. Can you tell me what is number 5? No, that one.
The reference,
the last page.
bibliography.
Can you please tell me the name of the scientist of reference number 5?
Yes, anonymous.
Who?
Anonymous.
Why?
Number 5?
You're saying Dr. Anonymous?
Okay.
Love it.
Keep dropping.
And so, Dr. Anonymous is a reference that you're saying is being used?
Last page of the FDA report.
I have it.
Yeah.
So, this is a reference that's being used by the FDA.
For the report that is used to take out my client's product out of the market.
Okay.
So this is the same story that the Mayo Clinic gave to FDA? It's the same one?
Yeah, it's there. Yeah.
Yeah, we don't know, it's just kind of hard for us to
Yeah.
follow.
Look at you again and just find out.
Yeah, it goes like, I'll do that paper somewhere, thank you.
I think we,
You'll bring him in and it'll be dark and changes his voice and he'll testify for you guys.
Recent,
Yeah.
oh, sorry.
Oh, I'm sorry.
No, no, no. Recent studies on valvular heart disease. Study made in Boston. Take out a population of 226 patients, similar to the FDA study, referenced by the FDA. It produced that only 4% gave positive to valvular heart disease. Can I read Dr. Tusi, can I read this?
Sure, can I ask one question
Yes.
before you read it? Dr. Berger here at Beth Israel, this, he looks at the 226, so this is an additional study.
That was done after the FDA after the FDA action on my client.
Okay,
That's what after.
terrific, okay.
The only conclusion that can be reached on Fen-phen and valvular heart disease to date is that studies have proved contradictory data on the extent of heart valve disease caused by Fen-phen. American College of Cardiology, editorial. Yes, sir. Yes.
So how were those patients selected?
Same way as the FDA selected.
Which is,
The FDA selected this patient from doctors who referred to them to the agency of a person who had a normal valve anomalies. So they were referred to the FDA, and that's how they. Okay, this study, yes, this particular study, don't know.
because I'm curious because it was done after it was recalled from the market. And how do we know we didn't miss people that had